Right, let's talk about something we've all experienced. You know that feeling? The doctor hands you a lab report and it's just this wall of acronyms and numbers. It can feel totally overwhelming, right? But here's the thing. Those tests are actually amazing tools for figuring out what's really going on inside our bodies.
And if you've ever felt that way, you are definitely not alone. I mean, what even is a CBC or an LFT? Well, guess what? Today we are going to crack that code. We're going to translate that medical jargon into plain, simple English so you can feel way more in the loop about your own health.
Okay, so let's jump right in. This guide right here, this is going to be our map. I want you to think of this as a guided tour of your body, but all from the perspective of what a simple blood sample can tell us. We're going to start on the highways, the circulatory system. Then we'll check out the engine room, the filtration plant, and yeah, we'll even do a little detective work.
All right, first stop on our tour, the circulatory system. Your blood, it's basically a super highway of information. And the most common tests, they give us this incredible bird's eye view of your overall health. We're talking about everything from the little cells floating around to how your body is gearing up to fight off threats.
So you've got the CBC, the complete blood count. This is the absolute workhorse of blood tests. It gives a really broad picture of your red and white blood cells. Then you have things like the ESR and the CRP. Think of these as the body's general alarm system. If they're going off, it's a sign of inflammation somewhere. A blood culture, on the other hand, is much more specific. It's like sending in a detective to look for the actual culprit, like bacteria, right in the bloodstream.
You know, our bodies are pretty incredible. Your blood needs to clot to stop you from bleeding, obviously, but you also don't want it clotting too much on the inside. It's a delicate balance. So tests like the PT/INR and the aPTT, they're basically a stopwatch. They measure exactly how long it takes your blood to form a clot. It's a great way to spot if things are working too slowly or maybe even too quickly.
All right, next up on the tour, we are heading to the body's engine room. We're talking about the endocrine and metabolic systems. These tests check out all the hormones and other substances that are running the show behind the scenes, controlling pretty much everything from your energy levels and mood to how you grow. Now, this is where doctors look for some really common stuff. You've got glucose and HbA1c, those are the go-to tests for diabetes. Then you have TSH, T3, and T4, which give a super detailed picture of how your thyroid is doing. And there are others too that can tell us so much about everything from your stress hormones like cortisol to whether you're low on important vitamins.
And here's a really easy way to remember the difference. A glucose test, that's a snapshot. It's a picture of your blood sugar at one single moment in time. But the HbA1c, that's more like the highlight reel. It shows the average of your blood sugar over the last couple of months. Both are super useful for different reasons.
Okay, our tour is moving right along. Next up, the body's heavy-duty filtration system. We're talking about the liver and the kidneys. I mean, these guys work 24/7 to clean your blood and get rid of waste. So these tests are all about making sure they're running like they should be.
So how do you actually check these filters? Well, for the liver, doctors look at certain enzymes, like ALT and AST. If the levels of these are high in your blood, that can be a big red flag for liver damage. And for the kidneys, they look at waste products like creatinine, and also calculate something called the eGFR, which is basically a score for how well the kidneys are doing their cleaning job.
And it gets even cooler and more specific than that. Check this out. The liver makes a protein called albumin. If your albumin levels in your blood are low, that might point to a serious liver problem like cirrhosis. But if they find tiny little bits of that same protein in your urine, they call it microalbumin, that can be an early warning sign of kidney damage, which you often see with diabetes. Isn't that wild? Same protein, two different places, two different clues.
Okay, so we've covered the general health checks and the big organ function tests. Now we're getting into some real specialized detective work. These are the tests a doctor orders when they have a hunch and they're hunting for a very specific culprit. And this kind of investigation can go in a few different directions. First, they might be hunting for invaders, infectious agents. This is where tests for things like typhoid, dengue, or of course, HIV and COVID-19 come in. Second, they might be looking for something called tumor markers. These are substances that can go up with certain cancers, like PSA for the prostate. And third, they might check if the body's own defense system has gone rogue and is attacking itself, which is exactly what happens in autoimmune diseases like lupus.
Wow, okay, we have covered a ton of ground on this little tour, but before we finish up, we have to make what is honestly the most important stop of all. And that's understanding the limits of these tests and what they can't tell us by themselves.
And here it is, the single most important takeaway. Seriously, let this one sink in. A lab test is just one piece of the puzzle. It's a clue. It is not the final answer. An abnormal result doesn't automatically mean you're sick, and a normal result doesn't automatically mean you're in the clear.
And here's why that's so crucial. Your doctor isn't just looking at a number on a page. They're looking at you. They have to take that number and put it into context with everything else. Your symptoms, your history, what they find in a physical exam, all those pieces have to fit together to paint the real picture of your health.
Look, understanding all this stuff isn't about trying to be your own doctor. Not at all. It's about being a better, more active partner in your own healthcare. It gives you the power to ask smarter questions and have more meaningful conversations. So the next time you see that report, you won't just see a secret code. You'll see the start of a discussion.
Like, share, and subscribe.